Good morning, good afternoon, everyone. Welcome to our panel discussion on the impact of access to electricity. I'm Shivani, and I'll be your moderator for today's discussion. Before we start, we want to acknowledge the Indigenous peoples of all the lands that we, panelists and participants, are on today as we convene on this virtual platform. Hosting this event from Canada, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. As we engage in these important conversations, we reflect on the harms and mistakes of past colonization and development practices, and consider how we as individuals and communities try to move forward in a spirit of reconciliation and collaboration to build a stronger world together. We are going to be recording this session, so we're able to share with those that aren't able to join us live. I'm just looking at our attendee list, and we have got about 40 plus people with us on the call right now, and still some more people joining. And at the end of the discussion, we are going to have time for some Q&A. So please, as questions come up as you're listening to the conversation, please add your questions to the Q&A, which is at the bottom of your Zoom screen. And if your question is for a specific panelist, add that as well, and we will be fielding those questions at the end of the discussion. Today's webinar is focused on access to electricity in schools and health centers in Zambia and Malawi. EWB's Engineering Brighter Tomorrows initiative was launched to bring electricity to these facilities through thoughtfully designed solar systems. Reliable electricity transforms schools by powering lights for evening classes, enables the use of educational technology, it ensures internet connectivity for access to global resources, and in health centers, it powers essential medical equipment, it supports refrigeration for vaccine, and enhances communication systems. So it truly has this massive ripple effect, which is why that focus on health centers and schools was selected. Through community-driven collaboration and strong partnerships with local organizations, Engineering Brighter Tomorrows ensures that our work is aligned with government plans and is responsive to community needs. We will have 4 panelists joining us today, so I'd like to start by introducing Dr. Martin Mbebwe. He is the District Health Director in Nimba in Zambia. He is a public health specialist with a degree in medicine from the University of Zambia and a Master's of Public Health from the University of Lusaka. Thank you for joining us today. Next, we have Thomas Mkandawire. He is the Senior Education Officer for Guidance and Administration at the Ministry of Education in Chipata in Zambia. He plays a pivotal role in shaping educational policies and administration. Thank you for joining us, Thomas. Next, we have Namunga Shikapende. She is EWB Zambia's Programs and Project Officer. She works closely with the Engineering Brighter Tomorrow project and is an engineer and sustainable development leader who spearheads initiatives focused on essential services, including energy access, digital inclusion, and access to water. And finally, we have Brian Harrigan. He is EWB Canada's CEO. He's an engineer with a degree from McGill University and an MBA from University of Ottawa. He has held CEO and exec level positions in the not-for-profit and private sectors in over 30 countries, including several in Africa. Thank you so much for joining us today, everyone. We hope to have a really informative discussion. So my first question is for Brian. Brian, for those who aren't familiar with the Engineering Brighter Tomorrows project, can you share the main goals and objectives of the project and how it fits into the broader context of the just energy transition, and also into EWB's broader mission and objectives, and what specific outcomes do you anticipate?
Thanks, Shivani, and hello to everybody, all the participants. Right now, I think we're at 53. That's great. Forgive me, I am going to be reading some of these points because there are too many in that first question. it's actually a gift and a curse at the same time because I could go on for quite a while, and I'll try not to, but I'd sooner over rotate on providing more than less info because a lot of this stuff is going to be used as a base foundation for the rest of the discussion, and so I think it's worthwhile going over some of these points, although it's going to seem like a lot at first. So again, thank you to the panelists as well to have joined today from Zambia. This project is Zambia and Malawi, by the way, but Zambia has moved so fast in terms of buy-in, in terms of able to work with the ministries and whatnot, that we've actually gone ahead and we're going to do our first pilot in Zambia. But certainly Malawi is also going to be receiving and is part of this project as well. So it's today's panelists are actually, three of them are from Malawi, but it doesn't mean that, sorry, Zambia, it doesn't mean we're not going to be working in Malawi. So so the main goals and objectives of the EBT project are to provide sustainable energy solutions to schools and health clinics in Zambia and Malawi, improving access to reliable electricity. We are going to ultimately significantly want to impact the educational and health outcomes of those schools and health centers. And we're going to begin with one pilot in Zambia. Ultimately, we want to have 6 schools and 6 health centers in both countries that will have access to electricity in a full comprehensive way. We think that the size of the systems will be roughly between 7.5 to 15 kilowatts, which again, does it mean something to the audience? Not sure, but that's basically enough to power a couple houses in the West, certainly in terms of all the needs. So that's not bad, given that a school can have, 1,000 children. So with the energy efficient appliances and technologies, we think that, and the more efficient solar systems nowadays compared to even a few years ago, it's doable. The primary goals, it's to, again, enhance educational and health outcomes. For example, in schools, to have reliable lighting, power for digital technology, and overall better learning environments. In health clinics, to have consistent power for things like storing essential medical vaccines and improve patient care generally. It's to promote clean energy. There's a great need for electricity in all of Africa, and even the government of Zambia is very pro-solar, but there's just so much demand. So let's go towards the clean tech and build local capacity at the same time. So local technicians and stakeholders in the maintenance and operation of these systems. The current challenges, which are going to be reviewed by Namunga in greater detail, but just to frame it up, in many schools in Zambia and Malawi have little to no access to reliable electricity, limiting the ability to use modern teaching tools and technologies. It contributes to poor educational outcomes, and it makes it difficult to attract and retain qualified teachers. In the healthcare sector, health clinics often face frequent power outages or lack access altogether, especially in rural areas, compromising the ability to provide continuous quality care and services. It's critical in health centers to run essential medical equipment, storing vaccines, and providing emergency care. And finally, also attracting and retaining staff. Availability of electricity is a significant factor in attracting and retaining skilled health staff and teachers. It improves their working conditions, and it enables them to stay on site rather than go sometimes fairly far away from the school or health center. The broader context of the just energy transition, that was the second question. So the EBT project aligns with the principles of just energy, which are equitable access to clean energy, particularly for marginalized communities. It supports a transition that's inclusive, promoting social equity and economic development alongside environmental sustainability. It contributes to reducing energy poverty and promoting energy justice by providing clean, affordable, and reliable energy. That's called the just energy transition. Our mission and objectives, it fits into our vision and mission. I am not going to read them, but essentially this is right in the pocket of working with local communities and marginalized populations, using engineering and technology for maximum impact in a systemic way. That's the next point, is systems approach. So it's a holistic perspective. EWB has prided itself on using a systems approach, systems thinking approach in all of its projects. At least we endeavor to try to do so. So it employs a systems approach, this project, considering the entire ecosystem of energy access from design to implementation and maintenance. The challenge is that many current solar projects suffer from poor design, subpar component quality, and unsustainable maintenance models, leading to early failures and ineffective solutions. Our approach aims to ensure high-quality components, robust design, and sustainable maintenance models to provide long-term reliable energy solutions. The involvement, input, and participation by the stakeholders, local stakeholders, including government ministries, provincial governments, district governments, equipment providers, and installers. And of course, it has to be appropriate for the local realities and resources built into the feedback loops of that is part of systems approach, which is you constantly improve and course correct. And I'm going to end on this one, which is I think the next question was, what are the anticipated outcomes? We talked about them briefly, but for educational outcomes, we want improved student attendance and performance due to better learning environments and higher pass rates and academic scores. We want enhanced digital literacy and access to information through powered educational technologies. There's nothing more demoralizing than the story of having to write a test when you're in grade 12 on ICT, information communication technology, and you don't have power in your school. So you haven't been able to use a computer or anything that uses electricity. Health outcomes, better healthcare delivery with reliable power for critical medical devices and storage of medicines, and increased operational hours and services of health clinics. Environmental and economic outcomes of the project are that there's a reduction in the carbon footprint through the adoption of solar energy, and economic benefits, we hope, as well, through job creation in the solar energy sector and reduced energy costs for institutions. And, even if an institution does not have access to electricity, they might have a generator, and the generator is very costly to run, and it's very polluting, but it's very costly to pay for the diesel, for example. If you have power from the mains, they're called, from the electric system, Zambia has load shedding that is regular, and it's predictable, but it can be significant impact, right? If you're off for 8 to 12 hours a day without power, even if you have the mains coming into your facility. So that's the reality right now. And so the call to action that we want is the importance of continued support and collaboration from donors, partners, and the community, because this project really has the potential, while supporting the just energy transition, to transform the lives of children, women, infants, boys and girls in Zambia and Malawi. So thanks very much.
Thanks, Brian. And the next question is for Namunga. Namunga, Zambia and Malawi, they face significant energy poverty challenges. Can you discuss why these countries were specifically chosen for this project and what challenges are being addressed in these countries?
Hi, so Zambia and Malawi were chosen for the Engineering Brighter Tomorrows project due to as you mentioned, they're experiencing significant energy poverty, and there's a critical need for reliable electricity in the underserved communities. So both countries face considerable challenges in providing sustainable energy access, particularly in rural areas. And in Zambia, about 31% of the population, only 31% of the population hampers essential services, including healthcare and education. Similar challenges with an electrification rate of around 15%, which is one of the lowest in the world. So that why it was of particular interest to do the project in Malawi as well. And the project addresses various challenges. When it comes to energy, providing solar The project is ensuring that schools and health centers have reliable electricity, which is going to transform the education outcomes as well as improve healthcare services. And beyond just powering the refrigeration at the hospital, even the healthcare workers are being targeted, which will hopefully motivate them as they, take care of the patients. And even in schools, for example, one of the schools Brian and I visited, the teachers highlighted that they actually don't like to stay at the school and they'd rather go to town because the town has power. And so they'll leave the students at the school on their own to run their own night prep, for example. But if they did have power at the school, they were going to love to stay at the school and monitor the students during prep time. So that's one of the reasons why we picked these two countries. And when it comes to health facilities, here in Zambia, for instance, 60% of the health facilities lack access to consistent power. So you can imagine how it is in the nighttime when they need to perform any nighttime procedures, such as deliveries, or even something as simple as sterilization. It's something that they can do. So by providing these sustainable solar energy solutions, we aim to ensure that the health centers can deliver quality healthcare consistently, and with schools, we can support the ministry and the teachers in being able to power their digital learning tools, as well as help them focus more on the students and provide evening study sessions. Another addition to this project is digital inclusion. We're incorporating digital inclusion into the provision of the solar power. So both schools and the healthcare facilities will be able to have access to smart systems. For example, healthcare need what they call a smart care system to be able to track their patients and even communicate with other health centers. And with schools, they need access to computers, to be able to access the internet, to even just have exposure to computers. So right now, some of the schools do have computers, but they don't have, the power of those computers or the internet to access the internet. And so students will go the whole year learning ICT without actually using the computer to facilitate their studies. And when they go to university and interact with other students who did have access to digital solutions, there's a very big gap in how they'll perform at school. So we're hoping to bridge that gap as well. So that's why we picked these two countries, because they have a need for energy as well as serious need for digital inclusion.
Thank you, Namunga. That was really interesting about the talent retention and also just the caliber of talent that schools and health clinics are able to attract when they do have reliable access to power. And also, as you said, individuals being on site 24 hours to provide those services, they're not going to be on site. They're not even going to be physically present if there isn't that power. And so ensuring that facilities are manned 24 hours to be able to provide some more of that emergency care as it arises. Thank you. So as we've been discussing, education and health facilities, they're the focus of the project, as there is significant potential of impact. Dr. Martin, can you briefly describe how the health system works in Zambia?
Okay, thank you. So I'm Dr. Martin, the District Health Director for Nyimba, which is in the eastern part of Zambia. So we currently service a population of around 157,000 people. So in terms of the Zambian health system, we basically have 3 layers of the system. So the first level is really the entry point into the health system. And this is basically made up of the health post, the rural health centers, and the district hospital. So these facilities basically offer basic preventive type of care and basic curative services. So in the case of Nyimba, we basically have 26 of such lower health facilities, which are health posts and health centers. And all these facilities refer to the one district hospital that's able to offer more basic surgical services. So after the first level entry point, every province has a second level hospital, which serves as a referral point for all the districts in that province. So these offer basic specialized services in medicine, pediatrics, obstetrics, and surgery. So each of our province has at least one of such a hospital. Then the highest level of care is basically the level of care, which is made up of super specialized type of services, as well as the teaching hospitals. So in terms of Nyimba being in the rural setting, we basically have only the first level of care, which is made up of the health post, health center, as well as a district hospital. So that's, in summary, how the health system is structured in Zambia.
That's great. And can you also share from your perspective, the broader impact that access to reliable electricity has on healthcare services and health outcomes in communities, especially for critical services like maternal and child health?
So as we basically heard, I think a good number of our rural districts suffer from energy poverty, in that a good number of our facilities are not part of the national grid. A case in point is Nyimba district, where out of the 27 health facilities, only 10 of our health facilities are part of the national grid. So that basically tells you that just 37% of our health facilities are part of the national grid, which means that over 60% of our facilities are not part of that grid. So even with the ones that are part of the grid, as you may be aware, we are facing a severe form of load shedding this year due to the severe drought. So our facilities face upwards of over 12 hours of not having access to power. So the impact of having a reliable, steady type of access to energy cannot be overstated. In terms of maternal health, we do realize that we are supposed to offer a respectful form of maternity care. When a mother comes in, we should be able to have adequate lighting, so that in that stage of delivery, we are able to offer that service even in the postpartum stage. We haven't been able to do that due to not having a reliable form of power. You find that our staff at times literally have to use their phones to be able to offer such a level of a service. And when you talk of maternal deaths, it's a public health emergency. You would want to have adequate lighting to ensure that you're able to offer this service. So having this level of a predictable form of access to energy would make a huge difference. In terms of child health, our primary healthcare facilities basically offer basic services. So immunization is the bedrock of the services we offer at the primary healthcare level. So when you talk of immunization, of course, you talk of vaccines, and vaccines have to be stored at the right temperature. So what that basically means is you need a stable form of a cold chain system. And we've suffered as a district due to this load shedding, in that we are now not able to guarantee the safety and the efficacy of those vaccines due to the long hours of load shedding. So that basically tells you how key it is to be able to have a stable form of power supply in our health facilities, because we would want to ensure that the vaccine we are giving to the eligible children is one of good quality and not just a placebo. And that way, we should be able to prevent vaccine-preventable diseases. The other key impact of having a stable type of supply of power is the motivation factor to our healthcare workers. You do realize that a good number of the skilled staff in a rural setting would have grown up in a more urban setting, and to be able to retain the level of skilled staff we need to offer quality form of healthcare services, you do need to offer a certain level of social type of service that's similar to where they grew up from. So having a stable form of power supply in our health facilities will be able to motivate our staff to stay in some of these health facilities that are quite hard to reach. So I think as NYIMBA, we are quite excited with the project that's coming up. It should be able to add to the number of health facilities that should be able to have a stable type of power supply. And in that way, we should be able to see an improvement in the key performance indicators, top of which is the maternal health. We do not want to see any mother dying. And you do realize that one of the biggest complications is postpartum hemorrhage, and you need good lighting to be able to see that mother and attend to that mother. So I think as a district, we are excited and looking forward to this project. Over.
Thank you. And so you mentioned load shedding. That's a daily occurrence, or how often do health facilities typically experience this?
So it's basically a daily occurrence. As I'm speaking, I have a genset running outside, and I think there's been a severe form in the last few weeks where we now have upwards of over 12 hours of load shedding in a day. So you can imagine what impact this is having on the efficacy of the vaccines, because we are unable to guarantee that the cold chain is adequate enough to be able to offer a safe form of a vaccine to our eligible children. So the severity of this load shedding now means it's about time that we moved towards solar, which is more reliable and predictable.
Absolutely. And you're saying about using phones for light for things like deliveries at night. Phones are also dependent on electricity and batteries. And so if that phone runs out of battery, suddenly you're left with really no options, because if there's load shedding being experienced, it's not just in that health facility, it's for that area as well. So it's very concerning that suddenly you can be left operating in the dark. So I can imagine how not just the experience from the mother's side, but also for the people that are working in the health facilities as well, as you were saying about retaining that talent and that caliber of talent. And I just want to give a reminder to the audience, please, as you are listening to this, continue adding your question to the Q&A. Dr. Martin, we have another question for you as well. So sustainability is obviously crucial when implementing any new project. So we wanted to get your insight into how you think what's the role of the Ministry of Health in supporting and scaling up electrification projects in rural clinics, and what, if any, has been lacking in previous initiatives?
So I think from the previous projects, what we've noticed is that the type of the solar systems that have been implemented haven't been holistic enough to cover all the elements of the health facility. Because one, there's an element of lighting. Two, there's access to the cold chain. And three, there's an element of being able to include the staff houses in these projects. So in most cases, we've been getting one or two of that set of three, which has in a way a compromise. So we've ended up with our staff trying to do illegal connections to be able to cover for all these elements. So I think in terms of having a sustainable type of impact, we would want to see a system that powers the staff housing, one that's able to provide adequate lighting, as well as power the cold chain. Then what we've also seen is that in the past, what's led to the unsustainability of some of the projects we've had is the quality of the batteries that we've basically had. I know that the panels themselves are able to last for quite a while, but the batteries that we've been getting, at most, you find that the lifespan is only for a year or two. And as you may be aware, our healthcare system in Zambia, we do not charge any user fees. So the running of the facilities is based on the grants. And the grants we get are operational in nature. They are not sufficient enough for capital investments like batteries. So you find that when those batteries run out, you do not really have the physical space to be able to replace those batteries. So for something that's sustainable, we would want to see the quality of batteries. Say, is it the lithium batteries? The ones that are able to have a much longer lifespan, because currently our physical space may not be able to allow us to be able to replace them if they just get one out within a year or two. And one other element we want to see is basically being able to work with the local staff. Are we able to have a skills transfer, even as we are doing these installations, so that we have local capacity to be able to maintain the solar systems? That will be basically put in place. In terms of the role of the Ministry of Health, I think there's a strong political will where they would want us to now go solar and go clean. So that level of political will means government is asking us to have more facilities being off the grid, because we've seen that it's a more sustainable form of energy. A very good example is the district hospital that we have, I think just last year, through the Constituency Development Fund. We had the generator that was bought. As much as it was bought, the running cost of it has been too high. We have to spend around 200 liters a day to be able to sustain it. And we have now realized that this is no longer sustainable. And if we had the choice to go back last year, we would have been better off investing that in solar. So in terms of the role of the Ministry of Health, I think we'd want to see more of the low maintenance and the long lifespan type of equipment put in place, because of the lack of the physical space for us to be able to replace these batteries. Over.
Thank you. And now to get an insight into education facilities, Thomas, welcome. If you could briefly describe the structure of the educational system in Zambia. Oh, Thomas, you're still muted.
Okay.
There we go. Yes.
Thank
Hi.
you so much. I had difficulties joining. Okay, so for the education sector in Zambia, we have 4 years of early childhood education, then 7 years primary, 5 years secondary, then 4 years tertiary education. Though we have a new curriculum in place, which will be operational starting next year, where the early childhood has been reduced to 3 years. Then primary will now be 6 years, and the secondary will be 6 years also. 4 years ordinary, then 2 years advanced level. So, but in primary school, some of the primary schools which run from early childhood to grade 7, but again, we have other primary schools that run from early childhood up to grade 9, which is junior secondary. So basically, that's how the structure looks like as at now.
That's great. And if you can share from your perspective, the broader impact that access to reliable electricity has on the learning environment and educational outcomes, and the overall development of students, particularly in rural and underserved areas.
Thank you so much. Electricity definitely works as a booster to our education system, because schools that have access to electricity, they have an advantage in that they're able to use a variety of equipment in the classroom. Equipment such as projectors can be used, computers can be used, and apart from that, there's just adequate lighting. Some days when it is crowded, certain learners with special education needs who have visual problems have difficulty seeing even during the day. And sometimes there is need for learners to do night prep, for instance, if we have boarding schools. So in situations where electricity is available, these learners have a lot of time to do their studies and to work around. Even as you are you may be aware, internet connectivity also goes with electricity. So schools that have access to electricity, in most cases, they may have access to internet. So this promotes e-learning, research. They can do their studies on their own. Even when they're given assignments, they can work on their own using the internet. And we see this mostly in urban areas, schools that are electrified, they're able to explore all these avenues. And there's more interactive learning, more participatory learning, because there are a lot of devices, audio, visual aids that are in place. But most of our schools in the rural area, they have no access to such, and as a result, they are not that exposed, and their performance is not as good as their counterparts in urban areas. Thank you.
Great, thank you. And Brian, this next question's for you. So as Namunga said, you were both, you were in Zambia for a field visit. What were some of those key findings from the initial project visits, and how did they shape the approach moving forward?
Yeah, thanks. And hi, Thomas and Martin, officially, I guess. Yeah, so Namunga and I were there in Eastern Province for about 4 days. And so it's Nimba, Petaoke, Kitete, and Chipata districts. And they were essential to being able to understand and have these conversations that some of this information that Thomas and Martin are sharing with us with a very local approach. So the current situation that we found from our assessment was on just these are general statements about these some of these, and then others are going to be more specific to the district. So generally in the education sector, I think it's been said that many schools in rural areas, and we have to understand that in places like Malawi, rural is about 85% of the population. In Zambia, it's maybe 60% or 55% of the population is rural. So many schools have little to no access to reliable electricity. So we don't have the modern teaching tools and technologies. One thing that was not mentioned, by the way, just yet, but I'm sure it's on Thomas's mind, it's also the ability for teachers to have e-curriculum and to be able to follow a certain curriculum, but also to teach to the right level and cater to the students who may be left behind by the faster paced curriculum. They could actually get access to more specialized curricular development. So electricity will enable that. Some studies have shown that there's up to 100-to-1 return on investment for investing in teacher e-access, e-teaching. It also, lack of electricity severely hampers after hours activities, and we're talking about post-educational, post-school activities, for example, curricular activities. So on the healthcare center, we talked about it. I don't think I'm going to repeat what Martin already pointed out, but some real examples from the districts that we went to. So in all districts we visited, 4 of them, that schools across these districts all suffer from significant power issues. For instance, Kawele's secondary school in Petaoke had a 34% grade 12 pass rate compared to 89% pass rate at the school just across the road. And everything else being equal in terms of, the kind of population that goes there, the kind of teachers they have, that one has electricity, the other doesn't. And it was a 34% pass rate in grade 12 versus 89%. Teachers are often relocated off-site due to lack of electricity, hindering after-hours student support. And the healthcare side, again, in these districts, we saw that they struggle with things as well, for example, like microscopes and centrifuges that also run on electricity. And in Petaoke, insufficient nighttime power compromise operations and safety. This was actually highlighted. This happens to them regularly. The other thing I just wanted to mention as well, when we're talking about all the drawbacks and all the problems, I think I also like talking about the positive. It's like with power, this is enabled. You have more people going to the clinic. You have more nighttime, studying and all that kind of stuff, rather than the counter negative thing. So we try to also say that it's not all doom and gloom. It's also here's all the positive things that can happen. Solar systems themselves, what we've noticed is that the existing solar installations are often inadequate, poorly designed, and unsustainable. Not all of them, but most of them, mainly serving limited functions like water pumping rather than comprehensive energy needs. Something as simple as maintenance of solar panels and dedusting them. Dust in Zambia forms quite easily in some seasons, and it actually reduces the photovoltaic potential by 50%. A simple hack like that, but that's just part and parcel of the bigger picture of having adequate training, maintenance, and a schedule to follow for the sustainability. On the solar provision and maintenance challenges, we saw that the absence of adequate infrastructure and maintenance facilities exacerbates the energy problem. And so most energy systems are under-equipped, poorly maintained. So that we talked about the batteries, Martin said, but there's other things as well that we noticed that were just not quality, because there's also the installation and the spare parts. There's also very few competent solar providers in Eastern Province. Most service and supply firms are headquartered in Lusaka. So there's a critical gap in both health and education sectors for comprehensive solutions that go beyond basic lighting, including essential electricity-enabled needs for digital inclusion and healthcare. The importance of digital inclusion is that Zambian government has, in theory, e-health and e-learning platforms designed for health centers and schools. But I think, as pointed out, in urban areas, that might be the case. But without reliable electricity, how can you actually have digital anything included, right? So there's also very clear impacts when you look at the literature on research in terms of what does having access to digital versus not do for both health and education sectors. Not going to quote studies, but we did a lot of research on that. And again, the ROI on that is about 25 to 70 to 1, depending on what the intervention is, just for access to digital. And so, for example, schools with reliable power can integrate ICT into their curriculum and getting better student performance. There's the telemedicine as well, by the way, that's available for health centers if you can have remote assessments from medical professionals elsewhere to provide advice. The other thing is with AI, you can actually have smart systems available by internet that will help train nurses and health professionals, for example, but at the same time answer very specific questions. And I'm going to try to summarize this fairly quickly. Shaping the approach moving forward. I think that was what did we learn from this, and where are we going? And so the systems approach I spoke about, it's the entire ecosystem of energy access. And we've done energy audits in a very specific way. So Engineers Without Borders is partnering with Engineers Without Borders Zambia. So Canada and Zambia collaborating with engineers and techies to actually help spec and design things properly. That's very important. But at the same time, the maintenance, the local training, etc., is incredibly important, and building up the capabilities of the suppliers as well. So poor design, subpar component quality, and installation is not across the board, but it's very patchy. So we want to address that. Local collaboration and capacity building is clearly a part of our systems approach, emphasizing the importance of local stakeholder involvement. These ministry, Thomas and Martin, are here showing their support, but it's also not just symbolic. Obviously, we want them to be part and parcel of the selection of sites, the design of the systems, the training up, but also the ownership. Right, a year after these projects, the key is handed over. The government owns these systems, so it's they have to also. If you don't have enough money for batteries, for example, what do you do? And so, well, one element is to get better batteries, but what are some other options? So we need to work together as well for that. And local technicians and stakeholders in the maintenance and operation of the solar systems to ensure long-term sustainability. So the call to action again is the continued support of the EWB community, donors. I mean, right now we've had the funding to do the needs assessment, which is this phase of the project, as well as one pilot. We're going to probably be putting a solar system, 10 kilowatt system, probably in an educational setting in Zambia. Very shortly, we're going to start ordering components and putting them in. But the funding to carry out the other parts is going to depend on donors. So we're counting on people partly in this audience and also many others, hopefully, to ultimately get a program where the government of Zambia and Malawi can actually take this on. Maybe there's also institutional support from very large foundations and governments that can come into this. So that's in summary what the plan is. I just wanted to quickly add as well that on the health side, there are many technologies that exist that are easy add-ons to this project, whether it's baby monitors that don't use much power or any power, whether it's certain diagnostic devices. There's a lot of appropriate medical tech out there that we would not reinvent. We will really want to bring into these situations as well. Why not? That's part of a systems approach. And so over to you, Shiv.
And so this is our last question before we move into the audience questions. And so this is both for Thomas and Dr. Martin. Looking forward, how do you envision the future of education and the healthcare landscape, respectively, in Zambia changing with the scaling up of access to electricity? And how can ongoing and future projects align with the ministry's goals to support this vision? What are some of the key factors that will determine the success of such transformations? Thomas, if we could start with you.
So looking forward, what we hope to see is we want to see a situation where all our schools, irrespective of location, whether rural or urban, they are connected to power, and this must be green and reliable energy, not a situation like we are facing now, where even the schools that are connected at the moment, they're just as good as not connected. So if we may have that kind of sustainable energy that is renewable, such as solar, that will work for us. And especially for schools in rural areas, which are essentially, they are far from the national grid. And the connection to hydropower is not even in sight anywhere. So if we can have the solar packages in these schools, and not only having those the installation, but the equipment that goes with it. That is, if it is internet and if it is the computers, the projectors, everything else needs to be supplied. And if we reach such a situation, then we know we'll be able to produce the learners that we want according to the national vision of education, to produce learners that are educated and skilled. So if we have to get all those skills, we need this environment that is conducive. And the way to go, certainly, especially in this era, is just to have the power that every school is needs. And like pointed out earlier on by other speakers, here in Zambia, availability of power also attracts teachers to those schools. So we have a situation where most rural schools, because they are not serviced, our teachers, most of them, especially those that are highly qualified, they would rather go somewhere else. So once in there, they stay for a short time and begin to ask for transfers. So in the process, we tend to have fewer teachers in the first place in those schools, and our learners are not able to get very good quality education. So we are envisioning a situation whereby there is no barrier. All schools, irrespective of where they are well connected, so that our learners can have clean water, which is powered by classrooms, so that not even through online and the like. So this is
Okay, I think that Thomas's connection is a bit unstable. So, Dr. Martin, if you can share from the healthcare side as well.
Thank you. So I think from a healthcare point of view, we've basically seen in the recent past, there's been an ambitious program by government to be able to recruit enough human resource for health. So having a better access to energy in our health facilities will mean that we should be able to retain much more skilled staff in our rural health facilities. And for as long as the community is able to buy into these projects, we should be able to see them be more sustainable. I think the drought we face as a country has been, in a way, a blessing in disguise, because now the buzzword is basically trying to go towards a clean form of energy. So what this means is that it should be able to benefit our health facilities, where we are now able to retain our staff. And once we retain our staff, it means our march towards universal health coverage will be enhanced. Our community won't have to move to the to the urban setting to get a very good quality of healthcare service, they should be able to get that service when they need it and where they basically need it, because we should be able to retain a very high quality type of staff. So we look forward to a time where each and every health facility has a reliable form of access to energy, because this makes a huge difference in ensuring that our outcomes are improved and we not have a child dying of a vaccine-preventable disease, or because we couldn't store that vaccine in the right form of temperatures due to a power outage. So we are excited as a health sector with this move towards having more clean energy. Another element is a digital inclusion. We've seen that almost everyone is now going virtual. I think with access to energy, our staff should now be able to have a better access to the internet. A very good example is this current week, we are having Child Health Week. And every day at 4 p.m., we do have a virtual meeting with all the facility staff. A good number of facilities, more than half, are unable to log in because of poor access to energy, which means that they cannot be able to access the internet. So I think with a better access to energy, we should be able to see better access to the internet, and we should be able to have that level of skills transfer, and we should be able to liaise with our facilities so that everyone is on the same page. Thank you.
Great, thanks. So we're going to move into some audience questions. We have quite a few, so if we can keep answers a little brief, we want to get us through as many as possible. So this first one is from Paul, and it's to Namunga. What's the community buy-in of these projects? What phase is that in?
The community buy-in. So to ensure the buy-in of the community, the initial trip that was done was to the provincial offices of education and health, who then linked us to the different districts. And at the district level, we met with various people, as well as the schools and the health centers. And by the time we got to the schools and to the health centers, they had already been communicated to by their provincial officers. So they were already expecting our visit when we were doing the energy audits. They're already expecting the team, and they were inquiring on questions with how maintenance is done, how the panels will be put, when the panels will come in, or when the system will come in. So the community buy-in has been 100%, receptive, and even as both EWBs, Canada and Zambia, part of the project involves capacity building to instigate local ownership. We want the community to feel like they own the project, like they own the solutions that we're providing, so that they can even do the initial first line maintenance, like Brian mentioned, like wiping solar panels. So we're also incorporating capacity building to ensure that they know the basics of the systems that we're bringing, and any technical people at those different institutions are trained to some level of capacity. So the community response has been very good.
Great, thank you. And this next question is to Thomas. Is there a training program that teachers can take to make the most out of the proposed power supply? And is there a plan to do adult education in the evenings if the facilities now have the power? Thomas, that question was for you. Oh, you're on mute.
Yes, I'll start with the last one. The Ministry of Education, through the Directorate of Open and Distance Learning, has a policy that in every school, each school, we should have adult literacy classes, so that the local community, those people who may have missed the opportunity to be in school and they are beyond school going age, they can benefit. So they can use the same facilities that is at school level after the learners have knocked off. So they can use the classrooms in the evening, say after 16 or so. to do adult classes so that they also have basic literacy skills to start with. So schools that have power already are doing that. And we wish to have more of them as they get connected to power. I missed the first part of the question, sorry.
Yeah, so it was about training programs for teachers to make, yeah.
Yes, what it is a few projects that we have had of similar nature in such communities. Once they have been given, I think quick ones I can cite on for water pumps. Some organizations have helped us with solar water pumps in some schools. And what has been happening is after the installation, a few of our teachers have been oriented on how to operate and just to do basic maintenance. And we usually carry this as an advice to whoever comes on board, just to give basics. There may not be detailed trainings as such, but just to advise them. Then apart from that, in each district, we have buildings officers. So we depend on them for a wide range of technical advice on various projects. So we bank on those. And if opportunity avails themselves, we take those for much more intense training so that they're able to give technical advice to the schools that have such installations. Thank you.
Thank you. And this next question is for Dr. Martin. What percentage of rural health clinics in Zambia have zero access to the grid? So you spoke about load shedding. How many are not even able to suffer through those potentially dangerously compromised services and care due to restricted electricity because they're actually off the grid and have no electricity at all?
Okay, so I may not be able to give a picture for the country, but I think I'll just give a picture on behalf of Nyimba district. So for Nyimba, we only have 10 out of 27 health facilities that are part of the national grid. That means the other 17 are not on the national grid, but what they do have is a basic form of solar system. So we do not have a single health facility that doesn't have a basic access to solar. So the other 17 basically do have, but would want to have a more reliable type of solar system. Over.
Great, thank you. And so just getting into the final two questions. So this individual supports an NGO in DRC who've had the unfortunate experience of solar panels being stolen. Under this initiative, are there any special measures to ensure the security of panels, or is it just not a problem in Malawi and Zambia? And maybe that can go to Namunga.
So when it comes to the security, it'll be handled by the health center as well as the school, but primarily it's being handled by the corresponding offices, which are the district health office, district education office, as well as provincial offices. So they'll be handling the security system. And currently, for rural Zambia, with regards to theft of solar panels, which is one of the benefits of localization, is that when we go to these communities, for example, they have a serious need for the panels, as well as the people around the health center have a need for the rural health center to have the solar panels. So the communities tend to have a neighborhood watch. So I can say they tend to have a responsibility towards the security of the systems that are put there, because they really want to have access to those systems. So security-wise, it's going to be handled by the officers, but also the community has a sense of responsibility to ensuring that those things are not stolen.
Thank you, Namunga. And I know that we're over time, so this is the final question for Brian. You can tell that we've got lots of engineers on the call. Can you provide some technical details on the power supplies you plan to provide? I assume that you're using solar cells to charge batteries. You mentioned an output of 7 to 15 kilowatts. Will the power supplies is this for 24 hours a day?
Yeah, so the answer to that depends on so many factors, but I don't want to get into a long technical discussion, but I think that there's two key components, the batteries and the inverters. And those have to be super high quality. So we're hoping to source those from local suppliers that are getting them from specific manufacturers based in China. China supplies about 90% of the world's batteries, or 85%, and for inverters it's close to that. But there's a lot of European companies that have footprint in China, so that's an important one. How did we come up with 7.5 to 15? That's still being worked out, by the way, by the needs assessment and the energy audits specifically. But it's a guesstimate for providing to what we thought was essential infrastructure with a little bit extra. Is lighting for teachers' quarters essential? We've heard from the panelists today that it is. Same for medical health staff. It's not going to save lives directly. It will do so indirectly by retaining staff and so on. And so all of that put together, we come up to this kilowatts. In rainy season, and that was one of the questions as well, is that these systems are being designed with battery storage so they will enable 24-hour backup supply, so that if the sun ain't shining, it'll still be you'll have a 24-hour supply. So that depends as well, not just on the panel sizing, but it depends on how many batteries, the capabilities of those batteries, even the cabling. And so we're taking a very serious look at the state of the art that's affordable, dependable, and the battery and inverter and panel technologies become so much better in the past 10 years and cheaper that it's actually really exciting time to be an engineer, looking at what we have now available, and the competition is fierce. So that's really all good. Zambia certainly has about probably 3.5 months of rainy season, but we've done calculations in partnership with the Solar Energy Center at the University of Lusaka, who've come up with a really handy guide. By the way, that's another thing, is academic partnership is also part of this project, where we're going to work with the University of Lusaka to help validate all this. They're the ones training the next generation of solar experts and solar investors. And so all that to say that we're getting that validated. We think that we're checking all the right boxes, and that we know the PV photovoltaic potential per region. If you're installing this in Chipata, it's different than installing it in Western Province and different in Southern Province. So we're taking that local approach. And if anything is covered in this project, it's probably the super technical aspects. There's a whole bunch of other questions that we'd love to get to, which I know we can't, which had to do with maintenance and sustainability. And we don't have all the answers to that, but we've certainly done a lot of thinking about that, what that might look like.
Thank you so much. And thanks to all of our panelists for joining us today, and all of our audience. As I said, we have recorded this session, so we'll have a copy of that available if there's any parts that you want to listen to again. Thank you all so much. Have a great rest of the day. Bye.
Thanks, everybody.
Thank you.
Thank you.